Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I would be talking about one of the associated deformity that is usually found in kids suffering from cerebral palsy, and that is congenital talipes equinovarus. A very big term but is very common. Congenital talipes equinovarus is one such deformity which is not only found in kids who suffer from cerebral palsy but even is found in other children as well. What exactly is this problem, what it leads to, and what is its management? We are going to discuss all of them in today's video. So make sure to watch this video till the end. Let's begin. Friends, congenital talipes equinovarus, also called as CTEV, is a deformity in which a child is born with an abnormal shape of leg. This particular shape keeps the foot of the child in a fixed posture where the foot is adducted, is in supination, is in varus or is inclined inwardly, axially and outwardly, and is rotated towards an outward direction, and also the foot is pointing downwards. This is a developmental disorder and is also called in layman terms as clubfoot. This problem is poorly understood, and that's why its management is not done that efficiently. And that's the reason it's important that its awareness should be raised among parents. Clubfoot or CTEV can be present in a child who don't have any other neurological disorder, or can be present in a child with neurological disorder. Some of the common neurological disorders along with which CTEV is found is spina bifida, spinal muscular atrophy, cerebral palsy, etc. But as I said, sometimes a child can be born without these problems. This problem leads to some developmental disorder for the child as well, as the child's ability to walk independently gets impaired if not corrected. And also this problem leads to some associated disorders or else problems like joint laxity, dislocation of hip, tibial torsion or else movement of the leg bone in different direction, and sometimes it's also present with absence of tarsal bone, which makes the ability for the child to stand and walk independently still more difficult. Now the question arises, why does this problem happens? This is a birth related problem, which means child is born with this problem. This birth related issue can happen due to multiple factors. One of such factor is the mechanical factor, which means there is a lot of intrauterine force that is falling on the foot of the child, making the shape of the foot abnormal. Bony anomaly, which means the shape of the bone itself is not developed properly, or else there is some absent bone like absent tarsal bone, due to which this deformity is happened. Abnormality in the connectivity of the tissue. If the foot muscles are not developed correctly, and this leads to connectivity issues or else laxity issues, the joints are more lax, due to which CTEV or clubfoot deformity is formed. Poor blood supply. If the blood supply to the foot muscle is not adequate when the child is in uterus, at that time also CTEV can be developed. And neurological abnormalities which could develop secondary to some other birth related condition like spina bifida. Now these are the reasons due to which a child can develop CTEV or else can be born due to CTEV. Now, along with this problem, diagnosis is very important, as there could be some other issues or else other foot related deformities that can happen in child. And thus diagnosis is made first intrauterine, which means the diagnosis of CTEV can be made when the child is inside the mother's womb by ultrasound scan. That's one of the earliest way or is easiest possible way to figure out and detect CTEV beforehand itself. Or else the second time this problem is identified or is diagnosed is at the time of birth itself, as when the child is born, the foot shape is not normal. At that time proper examination is done and diagnosis or its conclusion is made that CTEV is present or not. Now, what are the common life activity that will be affected due to this problem? Very obviously, child's ability to walk will be impaired because the shape of the foot itself is not normal, due to which the pressure that the child keeps on the foot is impaired or else is disturbed. due to which he develops balance issues, he develops other deformities at his knee joint, his hip joint, etc. The ability to stand independently, walk independently gets affected, and that's why there are more frequent falls. And that's the reason child later on in the later stages of their life can develop some psychological issues as well. Hence, it's important that this problem should be identified and corrected as early as possible. How much is the chance of this problem to be corrected? Well, if identified early on time, if the treatment is given in a correct way, this problem can be cured or else they can be corrected. Hence, having a good team of doctors or specialists who can help out in this problem solving is very important. Mostly the management is mix of physical therapy along with surgery or else orthopedic work. Point-aside method is one of the most proven and evidence-based method to correct CTEV or else clubfoot deformity. In this method there are two phases. One is the corrective phase and the other one is the maintenance phase. In the corrective phase, there are multiple settings of manipulation under anesthesia is done by pediatric orthopedic surgeon. In this process, the doctor manually corrects the position of the foot as the child is very young and the bones and the ligaments are malleable, and hence doing this manually becomes much more easier. After the manual correction is done, there is one outpatient small cut given to the Achilles tendon to increase the length of this Achilles tendon muscle, followed by which the child has to be maintained in the corrected position in the plaster cast. That forms the corrective phase, and then comes the maintenance phase. In the maintenance phase, which lasts for around 4 to 5 years of age, in this the regular periodic checkup with the doctor, regular wearing of the corrective foot orthosis or else brace, which allows the child's foot to be maintained in the corrected position, is very important. Initially, the child have to wear brace for 23 hours for first 12 weeks after the corrective procedure is done, and after that gradually night bracing or else keeping the brace on while the child is sleeping at night is advisable. This process or wearing of night bracing is maintained for another 2 to 3 years, for another 4 to 5 years till the child is able to correct the foot posture. Along with this, regular stretching exercises and strengthening of the intrinsic foot muscles, more of strengthening of hip muscles, gluteal muscles, calf muscles is equally important, and that's where role of physiotherapist come into the picture. If there are any signs of tightness which is observed by a physiotherapist will do passive stretching exercises to correct that tightness and prevent secondary tightness or other deformity and complications. And that's why this is a combined approach where orthopedic surgeons and physiotherapists work together hand in hand to help a child to recover from this problem. If all of these steps are done precisely and correctly, the problem can be corrected 100%, and that's why the initial years are super important, and parents should be cooperative, collaborative with the doctors and healthcare providers to help the child. And that's to help the child. Remember, congenital talipes equinovarus is a correctable deformity. All it requires is persistent trust in doctors and the team of professionals and regular input from parents' end. When we all work together, we can help child better. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.